Hello everyone, I'm Dr. Brad Homan, board-certified orthopedic surgeon in Orlando, Florida, and I'm here to talk today about PRP versus stem cells, and these are basically what we consider regenerative medicine treatments, primarily for knee pain, but they can be used for other musculoskeletal pains and injuries. And so if you've been told that injections like PRP or stem cells might be beneficial for you, then this video is going to be for you, because I'm going to break down exactly what the PRP and stem cells are and what they do and if it's actually going to work for you or not. So let's start by just talking about why knees hurt. And the main issue that we treat the knees for is going to be arthritis or degenerative changes. Bad tendonitis and tendinopathies can happen, and most of this stuff is age-related. Some of these injuries can be acute, but most of what we're treating with regenerative medicine is going to be more wear and tear, age-related, chronic injuries, as opposed to the more acute traumatic injuries. One of the main problems in the knee has to deal with the cartilage, and unfortunately when cartilage becomes damaged, it doesn't really regenerate itself very well, and so over time the cartilage will start to break down, and that creates arthritis. The inflammation from arthritis is what causes a lot of the symptoms, and that inflammation actually breaks the cartilage down even further, so it's sort of just a downward spiral once the process starts up. The inflammation that's created by the arthritis not only causes pain in the knee, but it can also cause swelling. And because it starts to break down the cartilage, then over time, the cartilage will start to kind of have these little nooks and crannies that will form in there. And so it loses this smoothness. And you can feel that by clicking and popping and catching in the knee, or even instability episodes. Also, as arthritis gets worse, the bone starts to become deformed a little bit. That inflammation has an effect on the bone where you start to get finger-like projections or sharp corners that are called bone spurs. And when the arthritis becomes really bad, you can actually get deformity of the joint, what people call knock knee or bow-leggedness. When it becomes that bad, it's extremely hard to deal with, because not only are you having the pain and swelling, but you've also got an alignment problem when your knees are no longer straight. I do have these little models here to kind of show the comparison between a normal knee and an arthritic knee, just so you can kind of see what it looks like. And the models are actually pretty accurate as far as the appearance, other than the color. So this is going to represent a more normal knee. The blue stuff in here is the cartilage that's on the ends of the bones. In between that, you're going to see these little rubbery cushions that we call the meniscus. This is what normal looks like. Everything's nice and smooth. Everything's all well-rounded. But as you get arthritis and the inflammation starts to change the structures, then it kind of starts to look a little bit more like this. So this knee is showing severe arthritis. If you can see, there's big bone spurs along the edge, so you start getting these sharp corners that come out. The cartilage, that smooth cartilage, starts to get very rough. The meniscus, as part of an arthritis process, also starts to break down, and then it can become very friable, and it doesn't function quite as well, and you can get tears in your meniscus as well, and those can also cause pain, swelling, catching, locking, popping, and all those other things. So that's really why knees hurt. If you want to see 5 tips to get rid of knee pain for golfers, go to golferkneepainnomore.com, because I've outlined a few tips and tricks that can help you get out of your knee pain. But back to the talk. So a lot of the traditional injections when patients are getting swelling and pain in the knee are going to be cortisone injections, which is basically a steroid. We inject the steroid into the knee to stop the symptoms. It reduces for a short period of time the swelling and the inflammation in the knee, and it can make you feel a lot better and sometimes even back to normal again. But it's temporary, and if the cartilage wears off, you get multiple injections, or the cortisone wears off and you get multiple injections of cortisone, it can actually start causing damage. Too much cortisone in the same location can cause not only cartilage breakdown, but if you're doing it in tendons, then it can actually cause atrophy and weakness of the tendon. Steroid injections are good for short-term relief. Sometimes if it's just a mild problem, they can be very helpful, but for a long-term solution, they can actually worsen the problem. So that's where regenerative medicine comes in, because regenerative medicine is using your body's own natural healing ability to fix the problem. So it's not like cortisone, which is a disease masking kind of a treatment. PRP, stem cells, regenerative treatments are actually disease modifying. And what I mean by that is that we're trying to get the process to stop. We're trying to stop the inflammation that is causing your cartilage to continue to break down more naturally. So we're basically stimulating your body to do that, and it's a much better long-term solution. And also, because it's not a drug, it doesn't have all the bad side effects of a drug. So what is PRP? PRP stands for platelet-rich plasma. And basically, it comes from your blood. We take a blood draw, usually about 60 milliliters, or we can get up to 120 milliliters of your blood, and then we put it in a machine, which is called a centrifuge. And what that does is it kind of like spins the blood rapidly, and that gravitational force within the machine will separate your blood into different layers. And we take a plasma layer that has all of the platelets and the growth factors, and that's what we use for its regenerative capabilities. And the way that I sort of describe platelet-rich plasma and what we're trying to accomplish is sort of akin to if you have an injury. If you get cut or if you get bruised, then what happens is your blood vessels will break and you'll bleed. And if it's a bruise inside, that blood forms a clot. And if it's bleeding out, then that blood will eventually also form the clot. It's the platelets that jump into action first. And so the platelets not only clot the blood, but while they're doing all that, they're releasing chemicals called growth factors. And those growth factors that are released by the platelets tell all the cells in the neighborhood, get in here and let's start a repair process. So it tells the stem cells, which can change into the tissues that you need to get into the area and start building new tissue. And it also, initially there's an inflammatory component, but eventually it'll also stimulate the inflammation to go away and initiate the healing process. So that's how I best explain what we're trying to accomplish when we take that platelet-rich plasma and we inject it into a problem area. And whether that is a bad tendon or whether that is an arthritic joint, we're trying to stimulate a healing response to reduce the inflammation, stop the progression of the arthritis, and basically improve the function. That's kind of how PRP works. So the data in PRP is very good, and we know that this treatment can be extremely effective, especially when traditional conservative treatments have not worked out. And so I would say for most people that have overuse problems, we always start with a conservative treatment, which would include things like oral anti-inflammatory medications, potentially activity modification, rest periods, strengthening exercise, ice, heat can also be extremely beneficial, bracing can be very helpful. And then as I mentioned before, there's a role for potentially one cortisone injection to see if it can solve the issue, if it's an appropriate use of that medication. But after those treatments fail, that's where the regenerative medicine treatments come in, and PRP can be extremely effective when those other treatments have failed. So let's switch gears and talk about stem cells. What are stem cells? These are cells that are found throughout your entire body that basically have the ability to turn into whatever tissues your body needs. So when there is an injury, the chemicals that are produced by the platelets will stimulate these cells to become the tissues that were damaged. The stem cells also have the ability to secrete their own chemicals to increase the healing response to even other cells. So because they're cells, they stick around a lot longer. Platelets have a very short lifespan, so to speak, but stem cells, being living cells, can stick around and provide their treatments for a longer period of time. So where we get stem cells in the regenerative medicine field, where we harvest these stem cells so that we can use them for regenerative medicine, are typically going to be bone marrow, which we get the bone marrow from your pelvis, or in adipose. Adipose is fat, so great places to get stem cell from your adipose would be on the side or even on your thighs. We know that adipose tissue or fat tissue is loaded with stem cells. There are a lot of other growth factors in adipose, and there are also some other cells called parasites, which have regenerative medicine potential. They can also turn into the repaired cells that you need. All of these treatments can be extremely effective in your problem spots to try and regenerate new tissue as well as heal what you have. There are another source of stem cells that they're not FDA approved in the United States, but those would be getting stem cells from the umbilical cords of healthy live births. And so stem cells in umbilical cords can also be used in humans to have regenerative effect. But for the most of the United States, the umbilical cord stem cells are actually not allowed by the FDA. Florida has recently passed a stem cell law which allows these cellular therapies to be utilized. As of right now, I think Florida is the only place where you can get these legally in the United States. Otherwise, you would have to go to another country. The FDA allowed sources of stem cells in the United States are going to be adipose-derived stem cells and the bone marrow stem cells. And the reason that one may work better than the other is age, for one. As we get older, the amount of stem cells in your bone marrow starts to decrease, just like almost everything else. As you get older, things become a little bit less effective. There's a word called senescence, which means that cells as you get older are not quite as as effective as they used to be when you were younger, and the stem cells in bone marrow are affected by this senescence. So as patients get older, bone marrow may not be as good of a choice. And so in my own personal practice, when I'm making a decision about bone marrow versus adipose-derived stem cells, age is one of the factors that I take into account to see which one might be better. So adipose has a lot more stem cells in it as far as the number of stem cells, but the stem cells in adipose have been found to not be subject to the senescence or the age-related decrease in effectiveness that is found in bone marrow. So putting all that together for an individual patient is part of what we do to figure out which treatment would actually be more beneficial for which patient. PRP versus stem cells, what actually works? And the conditions that we treat primarily, or I would say most commonly, are going to be arthritis, like osteoarthritis, tendons and ligaments, like tendonitis, golfer's elbow, tennis elbow. These are all inflammation, chronic inflammation of the tendons around the joints. Once you get to that level, your body has lost its ability to get in there and induce the healing response, and therefore, if we do the injections into the area, it basically kind of stimulates your body to get back in there and start working to get these areas fixed. Sometimes meniscus tears in the knee can also be beneficial or have beneficial effects with regenerative medicine treatments. Just going to use this knee model again to kind of show what a meniscus is. Inside the joint, you've got these two rubbery cushions on both sides, and these are called the meniscus. Their function is as a shock absorber. They're basically trying to keep the two bones, the femur and the tibia, from hitting each other too hard. But sometimes the meniscus can tear, and certain types of meniscus tears are also can be treated with PRP or stem cells very effectively. Larger meniscus tears that are causing mechanical symptoms, clicking, locking, popping, especially if they're like large flaps, those are not going to be as amenable to treatment with regenerative medicine. But MRI scans and physical examination in the office can help us figure out what kind of meniscus tears would be of some benefit, or whether or not this treatment would be helpful for a meniscus tear. So as far as which is better, the answer is kind of neither, actually. So they're both extremely effective, they just work in different ways. And so I would say if it's a more mild form of a problem, like a mild tendonitis, or if it's mild arthritis, then platelet-rich plasma is a pretty good way to go. It's a little bit less invasive, it doesn't cost quite as much, and it can be extremely effective to stimulate your body's healing with the cells that are available. More significant problems, more significant arthritis or tendon tear, then the stem cell therapy is probably going to be a better option, because it's not only stimulating the other cells in the area to start a healing process, but you're actually providing all of those cells that you want to form the new tissue that you need. And so for more significant injuries, then the stem cell treatment is probably the best. I've also found, though, in different cases, multiple PRP injections can have almost the same effect as a stem cell treatment as well. And you can expect with either one of these, platelet-rich plasma or stem cell therapy, you can expect to be completely pain-free or nearly completely pain-free for 12 to 24 months. And that is without having to take harmful medications, that is without needing cortisone injections, which potentially could cause damage to your body as well. So these treatments are extremely effective long-term, and they're much safer for you because they don't have the side effects of any sort of medications. These are chemicals and cells that are produced from your own body that are put right back into your body. And so because of that, it's got extremely good safety profile. So who's a good candidate? It kind of varies, but I would tell you that most of the people that we start to see for these regenerative medicine treatments are going to be age 40 or older. Sometimes in younger patients that have had injuries that have not healed properly, they're great candidates as well. So any situation where you've got a condition that's either been going on for a while and the body hasn't been able to fix it, and normal conservative treatments haven't been able to get the problem solved, that's a good candidate for regenerative medicine. And then if you've got a condition that's not really curable, like arthritis, the only solution that we have to that surgically is joint replacement surgery. So that's a condition where regenerative medicine can be amazing because it's stopping the progression of that condition, and for many patients it keeps them out of the operating room. Younger athletes that, especially like CrossFitters or marathon runners or other people that are doing more impact activity or that had old ACL injuries when they were younger, younger athletes are starting to get a lot of cartilage problems in their knees, including certain types of meniscus tears, which can be extremely effective as far as the treatment with regenerative medicine. So, and again, it's avoiding drugs, it's avoiding side effects, effects. It's avoiding putting things into your body that may have potential harmful effects. It's using your own body's regenerative medicine, your body's own healing ability to fix the issue that you have, and it's a much more permanent solution. So the big takeaway here is your knee is unique. Every condition could be a little bit different, so you don't make a decision based on marketing or whether you heard this pro athlete had these treatments or whether it's just somebody that you know may have had good success with something. You really need to decide based on science and expert evaluation, and that's where having somebody that is a professional, a medical professional that has experience in these therapies can give a really good, honest answer as far as what treatment might be the best for your specific condition and develop a protocol that's going to help you moving forward. So if you found this video helpful, please give it a thumbs up, hit subscribe. You can comment below. I'd love to see those comments. I'm Dr. Brad Homan, sports medicine physician. Thank you for watching, and stay tuned for more future videos about knees and orthopedic issues and health and wellness. So in the meantime, stay active and keep your knees healthy.